So I'm not for very long. I'm just happy that Sanisha has managed to organize this for us. I want to just turn over to my boss, Mrs. Laura Chin, to just ask her to add her words of welcome.
Yes, I want to thank the NHF and you, Sanisha, for organizing this and also for being so responsive over the years to requests we have made for adding conditions for coverage. So we're very grateful to you for what you do and for your efficiency in what you do for not only our members but for all Jamaicans. And so I'm delighted that so many of our members could join this afternoon, and we're looking forward to this. So over to you, Sanisha Pearson.
Thank you so much. And I certainly will share your high regards with the rest of the team. Won't keep it all for myself. Before we go into the presentation, let me just quickly share my screen. All right, should be seeing.
Yes.
Yes, we've got you.
Great. So once again, good afternoon, everyone. As I was so nicely introduced a bit earlier, I'm Sanasha Pearson-Williston, Health Promotions Coordinator with the National Health Fund. And it is indeed a pleasure for me to be here sharing with the members of the CCRP today regarding the offerings or the services that are offered by the National Health Fund. I know that for many of you, this would not have been your first introduction to the NHF, but certainly since when we last spoke or since your last introduction, we would have added a great amount of new conditions to the program. So before as we go into the presentation, we'll just start with a brief overview of the National Health Fund, who we are and what we do. So the National Health Fund, of course, is an agency of the Ministry of Health and Wellness, and we were established to reduce financial burden of healthcare on the population. As to how we are funded, we receive our revenue from special consumption tax that is offered on tobacco products, as well as portions from the NIS, which is the National Insurance Scheme. Our vision, no financial barriers to healthcare. And our mission is to provide funding for specified healthcare benefits, health promotion, health projects, and pharmacy services in a sustainable, efficient, and customer-centric environment. What we do, we assist Jamaican residents to access medication in both the public and private health sectors through the provision of the NHF card. And we also assist with the delivery of inpatient and outpatient pharmacy services for the public health sector. This includes the management of the medical warehouse and over 104 pharmacy locations in the public health system, providing full-time and scheduled services. Allow me to just admit some members here before proceeding. And then finally, the NHF was established to provide funding to institutions to improve healthcare delivery, including health infrastructure and the upgrade of medical equipment and transportation. Now, the support that we offer in two categories. We offer through the NHF individual benefits, which is where we assist individuals to meet the cost of filling prescriptions for specific illnesses. And we do this through the provision of the NHF card. And then there's the NHF institutional benefits, which is where we support organizations that provide healthcare in Jamaica. Total enrollment for the NHF, over 674,000 as shown on screen, and for JADEP, over 100,000. Now, as we get a little further into the presentation, some years ago, we were up to covering 18 chronic conditions. Today, we are up to 24 conditions. So the NHF provides coverage for 24 conditions, with two of our most recent additions being attention deficit hyperactivity disorder, ADHD, and cervical cancer. So permit me to go through all the conditions that we cover, because over the past 2 years, we would have added a great number of conditions to our offerings. So as I mentioned earlier, attention deficit hyperactivity disorder, or ADHD, is one of the conditions that we most recently added. We also cover asthma, arthritis, breast cancer, benign prostatic hyperplasia, cervical cancer was also added this year in April, colorectal cancer, diabetes, epilepsy, glaucoma, major depression, multiple myeloma, Parkinson's, and prostate are conditions that we would have recently added as well. Psychosis, high cholesterol, hypertension, ischemic heart disease, lung cancer, lupus, and rheumatic heart disease are covered. Sickle cell, thyroid disease, and vascular disease would round out the 24 conditions that are currently covered. Then within the NHF card program, there is also the provision of benefits for beneficiaries that are 60 years and older. And we do this under the JADEP program. Now, JADEP is the Jamaica Drug for the Elderly program. And this is where our beneficiaries who, having registered with the NHF and are now 60 and over, they automatically qualify for JADEP benefits. And what are JADEP benefits? This means that for these 10 chronic conditions that are currently displayed on screen, you are able to receive select medication for these conditions free of cost at JADEP participating pharmacies island-wide. You are only required to pay a pharmacy fee of $40 per drug item, up to $240 for 6 or more drug items. Now, one of the common questions we get when we introduce this benefit to individuals or even to current beneficiaries, one of the main questions we get is, if I already have an NHF card, do I need to apply for JADEP? Or if I have a JADEP card, because years ago we would have had 2 cards. So we'd have had a separate card for NHF benefits and another card for JADEP benefits. So the concern from many individuals is whether they need to now apply for a new NHF card if they have a JADEP card, or whether if they have an NHF card, they now need to apply for JADEP. And the answer to both of those questions is no. Once you have an NHF card and you are now 60 or older, you automatically qualify for JADEP for any of these 10 conditions that are displayed on screen. And I know that there might be a concern as well about availability of these medications or medications that are accessible under this program. So a little later in the presentation, I will share with you about the NHF's Ask Your Pharmacist program, which allows you to contact us so that we can assist you with getting the medication that is offered under JADEP. Now we'll talk a little bit more about the NHF card, more specifically who is eligible for the NHF card. The NHF card is offered or is available and accessible to all.
Okay. So I see it tomorrow.
Marcia, is that a question for the group?
Okay. Okay.
Hi, Marcia, is that a question for the group? All right, it doesn't seem so. So we'll continue in discussing the NHF card. So the NHF card, as I would have mentioned earlier, is available to all Jamaican residents who have any of the 24 conditions that we currently cover. And this is
No.
Regardless of your age or your economic status.
I'll take care of it.
Would allow me a moment just to mute all the members so that we are able to hear clearly. Thank you so much for that. So all Jamaican residents, irrespective of their age or economic status, they are eligible for the NHF card once they have any of the 24 conditions that are covered by the NHF. And the benefits that are covered under the NHF card, I'm sure many of you already know about the subsidies that is provided on prescription drugs, which means that we offer discounts, or we offer a subsidy rather, towards the purchase of select medication, select drugs for the 24 conditions that I would have mentioned earlier. But we also do cover respiratory devices, diabetic supplies, diagnostic tests, and we offer double subsidy for children. And what this means is that children 0 up to the age of 18 years, once registered on the NHF card program, they are given twice the amount in discounts that is offered to adults. And if you already have your private health insurance, then this should not be a deterrent in applying for the NHF card, as your private insurance can be combined with your NHF card and you will now pay less out of pocket. As mentioned earlier, we cover respiratory devices, but to be a little more specific, along with subsidizing the cost for asthmatic medication, the cost for asthmatic spacers and masks are also subsidized for our beneficiaries. And as we know, spacers and masks are critical in ensuring that children and the elderly are able to receive their asthmatic medication in the correct dosage. We also cover for beneficiaries who are registered for diabetes. We cover test strips, which they use to measure blood and urine sugar levels. Lancets are also covered, which is the prick that is used to obtain the droplet of blood. Syringes and needles are also covered, which we know is used to administer insulin dosages. But along with these offerings, beneficiaries on the NHF card program who are registered for diabetes and would have used their NHF card at least once to purchase diabetic drugs are also able to access a free glucometer from the NHF. Now, in order to access this free glucometer, what would be required, as I mentioned earlier, you must be registered for diabetes with the NHF. You would have had to use your NHF card at least once, and then you can simply contact us and share with us the brand glucometer that you'd like to request. We have a full list of brands that we supply, or that are supplied rather, and then you're able to, after having a discussion with your doctor or pharmacist, tell us which brand of glucometer rather you would like to procure, and then we are able to process that for you. Processing for a free glucometer takes 1 to 2 weeks. You provide us with your NHF card number. You will also be required to provide us with your contact details and a pharmacy closest to you where we are able to send the glucometer for you to be able to have access. We also cover the HbA1c test. Now, for diabetics on the program, they are allowed 4 tests annually. So that is 1 test every 90 days. And beneficiaries who are not diabetics are allowed 1 test annually. The breast receptor studies test, which we know is key, or which is key in diagnosis of breast cancer, diagnosis and treatment rather, that is also covered. It's a lab test done on breast cancer cells to determine hormone receptors or biological therapy receptor status. Now, this test is also covered under the NHF card program. And I would have mentioned earlier that we offer double subsidy for children 0 to 18 years. Then our newest additions, the PSA test, which is the prostate-specific antigen test. That's a blood test that is administered to men, and it tells us the amount of prostate-specific antigens that are within the blood, and it's a key indicator as to whether men may later develop prostate cancer. And this test is also subsidized by the NHF, so men aged 40 up to 75 years get a $1,600 discount each year off of a PSA test. Want to just pause for a moment right here in the presentation to indicate that to be able to access this benefit, you do not have to have or be diagnosed rather with any of the conditions that are covered under the NHF card program. Once you're male, you're within the ages of 40 and 75, then you are able to access an NHF card and be able to get this benefit. Similarly, we now offer a benefit on pap smears, and this is offered for women aged 21 up to 64 years of age. They get $1,300 off a pap smear rather every 3 years. In the event that a woman might be high risk, that is living with HIV, they can access the pap smear benefit annually, of course, through the recommendation of their doctor. And similarly, for the PSA, women would not need to have any of the conditions that are covered by the NHF to access this benefit. Once you are within the age range, then you can apply for the NHF card and access this benefit. And I'll speak to you a little bit later about how the actual application process, given that you would not have been diagnosed with any of the conditions that we cover. Now, we do have card center locations right across the island where you are able to submit applications, whether for update of your NHF card or whether you're just applying for an NHF card or whether you want to access the benefits for PSA or for pap smear. You're seeing on screen that your card will be ready and processed in minutes. And the locations are now being shown on screen. However, the locations for application are available on our website and on the back of the application forms, which are available at doctors' offices, pharmacies, clinics, and card center locations island-wide as well. Now, along with the NHF card benefits, there's also the drug-serve pharmacies. Currently, we operate 106 drug-serve pharmacy, full-time pharmacy locations across the island. And drug-serve pharmacies are public sector pharmacies that are located at government-run hospitals and selected health clinics across the island. And if you're a public patient, then your medication is free at a drug-serve pharmacy. What this means is that once you have a prescription that is written from a hospital or a health center, then you're able to access select medication free of cost at these full-time pharmacy locations at hospitals and clinics across the island. And to ensure that when you visit our locations, that you are able to access your medication in a timely manner, we have implemented several options for you to fill your prescriptions. And this includes the schedule refill program. Now, the schedule refill program is for persons who might have repeat prescriptions. So if you have a prescription that is upward to about 3 months, you can speak with a pharmacist at DrugServe and they will add you to this program. You'll be issued a card and your medication will be filled before getting to the pharmacy. So you'll be given an appointment date on that card, and then they're able to fill your prescriptions for you, and then you come in and collect, which significantly reduces your wait time at a drugstore pharmacy. There's also the drop-off and pick-up service. So in the event you want to drop off your prescription at the pharmacy, but you don't want to wait on that specific day, or you have some business to take care of, something to do, you can indicate to your drugstore pharmacist that you would like to simply leave the prescription and collect it at a later date. That would be accommodated. Then there is the Quick Prescript app. Now, this app is available on Apple and also Android devices, and this app allows you to take a picture of your prescription, upload it to the app. It is submitted to the NHF drugstore pharmacies. We're able to fill the prescription and respond within the app to let you know a suitable time for pickup. So that is also an option that you can bear in mind if you plan to fill your prescriptions at DrugServe. Then a little earlier in the presentation, I would have made mention that a common concern I know for many persons that are eligible for JADEP is that they're unable to access the drugs, or the pharmacy that they go to sometimes might not have it. And so I want to introduce you to the Ask a Pharmacist program. Now, this program allows for you to have dialogue with a drugstore pharmacist, and they will be able now to assist you with locating your medication or where the drugs might be available. And not only for that particular service, but if you have any medication related queries, then you are able to speak with a drugstore pharmacist and they're able to help you with resolving those. And you can access this service between the hours of 8:30 a.m. to 4:30 p.m. You can do so using our web chat platform, which is available on our website. You can call us at 906-1106, or you can send us an email at rxsupport@nhf.org.jm. Quickly, how do we apply for the NHF card for those of us who have not yet applied, or you've heard a condition today and you'd love to apply to get covered for that specific condition? You can retrieve an NHF card application form. I would have mentioned before that they are available at doctors' offices, pharmacies, clinics, hospitals, and even on our website. Once you retrieve a form, then you would be required to complete section A of the application form, and you must insert your TRN in the space provided in section A. Section B should be completed by the guardian for persons who are 18 or under, rather, the age of 18 years old, if they might be incapacitated or under the care of an institution, then section B would also need to be completed. Section C of the application form should be completed by your doctor, certified by your doctor, so we can know what conditions to add to the card. The doctor will also include their medical registration number, which is their MCJ, and their signature. Once this is completed, then you are able to submit the application form to any of our card center locations island-wide, and we process that card for you within minutes. Point to note is that if you are now wanting to access an NHF card specifically for PSA or pap smear testing, because you would not have been diagnosed with any of the conditions we cover, then all you are required to do is to complete section A of the application form. This means that you don't need a doctor to complete the form, section C of the form. Simply complete section A, take it into one of our card center locations, and we will process and issue you a card for those specific benefits. That's the PSA for men and the pap smear for women. The application form, an updated version of the application form, which includes the PSA and pap smear and all the conditions that we now cover, is available at our website, and our website is nhf.org.jm. Another point to note and another development, well, not so new, but fairly new development within the NHF is that doctors are now able to submit your application form on your behalf from their office. So on your next doctor's visits, whether after this presentation you're looking to apply or you're looking to update your card with some of the new additions to the program that I would have mentioned, you would want to engage your doctor in a discussion about using our online registration platform for doctors to submit your application form on your behalf. We've had raving reviews from many of our members about how quickly rather, and how efficiently they are able to access their NHF card once their doctor uses this service. And that would bring me closer to the end of my presentation. Just want to remind you of the ways to contact us. There is the web chat platform, which is available on our website. That is accessible between the hours of 8 a.m. to 4 p.m. Mondays to Fridays. You can call us at 906-1106 or toll free at 888-342-5643. And you will be able to reach someone from our customer care department. You are able to access customer care within the hours of 7 a.m. up to 7 p.m. Mondays to Fridays. You can also email us at info@nhf.org.jm, or you can visit our offices. Our head office is at 25 Dominica Drive, Kingston 5. And of course, we have our same-day card print service locations across the island. You can also follow us on social media at NHF Jamaica. I want to thank you all for accommodating me to present to your members this afternoon. And at this time, I open for questions or any comments that you might have. I'm seeing that Miss Brown has her hand raised. Miss Brown, you can go ahead with your question.
Okay, hi everybody, my name is Laurice Brown. I think I have, one is a two-part question. The pap smears, to get the benefit, if you already have a card, you don't have to do anything else?
That's a very good question. And the answer to that is no. Once you fall within the age range that I would have mentioned earlier, 21 up to 64, then you automatically qualify for that benefit. And if
Okay,
sorry, go ahead.
I said part B of that, why is the age range cut off at 65? Because I was told by a doctor that persons, I am 78, so persons who are, the older you get, he says I'm to still do no lie. I'm sorry, I take that back. It's mammograms he was talking about.
Okay.
Okay,
Right.
I just have one other thing.
Yes.
Why is it that most antibiotics, I was told by the pharmacist that antibiotics given for any of those stated illnesses, whatever, lupus, what have you, that's the only antibiotics you cover now. Antibiotics are one of the most expensive drugs the other day. I got 10-day one and for 10 days, and it was almost $9,000. But what it also is some ENT thing or what have you. Now, a perfectly healthy young gentleman playing football can get a cut. Why doesn't NHF cover antibiotics generally across the board?
So in answer to your first question, or was it your second question? Just to note that the 21 to 64 is the stipulated guideline for pap smears, hence why that was indicated as a stipulation to access that particular benefit. And to your third and final question, very good question indeed. The NHF does review from time to time its coverage on medication. So I would love to introduce you, Ms. Brown, to the individual benefits request form, where you are able to indicate to us that you would like to have a particular drug covered on the NHF, and you could share that with us, and it will be taken into consideration when next we are in discussions about adding a new drug or new condition to the offerings that are currently available through the NHF.
The thing is that the antibiotics will vary from time to time for various things that are not related. So each time you'd have to come up there and ask for that specific antibiotic.
Right, and that is why it's a continuous process in terms of adding new conditions and new drugs to the NHF card program. So certainly for the antibiotics that you are referencing currently, that discussion could be had after submission of your individual benefits request form. However, after that submission, we would be able to take that into consideration when we are in discussions, as I said before, about what drugs we cover in the near future.
Okay, thank you very much.
You're most welcome, Ms. Brown. I hope that would have sufficiently answered your question. And I see also that Ms. Patterson has her hand raised. I'm
Sorry, I was unmuted. Yes. Thank you so much. That was a great presentation, very informative. I just wanted to mention, you just mentioned that you can apply and see if you can get a particular condition covered. And I have to say that we had sent in a request, I think it was for about 9 conditions, and NHF had added 5. And I'm sure they're working on the other 4 that we asked for. But we repeat that request again.
Yes.
So if our members wish to send us an email and with their suggestions for conditions that they would like to be covered, we could just put it all together in a request to NHF.
Great. I support that idea. Ms. Patterson, are there any other questions at this time? Just looking to see if we have any other raised hands. I'm seeing Paul has his hand raised. You can go ahead, Paul.
Okay, thank you. I was just wondering why there is a cutoff age for the ladies to do the pap smear and for the gentlemen to get their PSA testing done. Why is there an upper cutoff age? I can't understand.
Right. I would have mentioned a little while ago, Paul, that we would have been in alignment with the recommended age groups or the local guidelines for those particular screening tests. However, if it is a situation where this is something that is being maybe recommended by a doctor, then I'd suggest maybe submitting something to the NHF so we are able to see how we can accommodate offering that benefit.
Okay, so you suggest that we ask our doctor to intervene? I'm not understanding.
Well, no, I'm saying in the event, I would have mentioned earlier that the allowance for the pap smear is $1,300 off of a pap smear every 3 years. However, for women who are high risk, with the recommendation or upon the recommendation of their doctor, they would be allowed that subsidy annually. So I'm saying we would have been operating within the local guidelines, hence why we would have had that age group stipulation, but I was suggesting that maybe you could send in your concerns, and then of course that could be discussed, and we would advise maybe how we could accommodate.
Okay, all right, thank you.
Dennis, I'm seeing Dennis also has a hand raised.
Yes, thank you. I'm just following from what the other gentleman is saying. you're saying that the recommended guidelines are X, but the urologists are still prescribing the PSA. So
Yes.
I don't understand when you say the local guidelines, and then we are hearing something else from the consultants in this area. I was wondering, I mean, how you reconcile those two?
Certainly understand your concern, Dennis. So unfortunately, I will not have all the answers for you this afternoon. However, what I can do is to direct that concern internally and be able to provide some updates to Ms. Pattison after this meeting as to how we maybe could accommodate based on the concerns we have today that offering, or I could provide an official response as to the way forward relating to that particular age limit.
Okay, thank you. It's just that if it's a problem of cost or finances, that is one thing.
Yes.
But if it's a case of guidelines, that is something else.
I
Completely
totally
different.
understand, Dennis.
Okay, thank you.
You're welcome. Elizabeth, I'm seeing that you have Miss Ross, I'm seeing you have your hand raised.
Yes, good afternoon. My concern is again the cutoff date for the age limit for the pap smear.
Yes.
I heard your explanation, so you don't have to repeat it, but just to say that I am 73, and the last time I did one, which was 2 years ago, my GP said, "Oh, you don't have to do this again." And then I go to for my thyroid checkup, and that doctor said, no, don't stop your cancer tests, because my wife got cancer late in life. So I would just love for you. You said that you would follow up on this internally. So see what you can do in terms
Most
of
certainly will, Miss Ross.
extending that cutoff age.
Right. So unfortunately, I wouldn't be able to answer from a medical perspective, but as I would have mentioned earlier, certainly the concerns can be shared with us, and then an official response can be shared after this meeting, outside of the meeting with with the CCRP, as to how we would move forward with that particular limitation on the screening tests that are currently offered. I'm seeing Miss Wedderburn.
Yes,
Can
thank
go
you
ahead.
so much. This has been very helpful. I think my question is similar to the lady just before me, 80 years old. And my doctor feels that there's no reason for me to stop doing either the pap smear or the mammogram. I currently have a female family. I mean, I know that cancer is not hereditary. This is not what I'm suggesting. I have a female relative, my niece, who is mid-50s, and she was recently diagnosed with cervical cancer, third stage. So I don't understand why we should stop doing the test.
Well,
it makes me very nervous.
Certainly, in my presentation here this afternoon, I was not suggesting that women who fall outside of this age range should stop doing their pap smears. It is just that there's a specific limitation as it stands on who can access or who is eligible for these particular screening tests that we currently offer. I have heard the concerns, I have noted them, and I'm sure Ms. Pattison can assist me, or maybe after this meeting, putting together those concerns, and then we can look at them and provide an official response as to how we proceed forward.
Right. Thank you so much. I do all my tests with the Cancer Society.
Do that. Great.
Ever since. So I would like to be able to continue to support them.
Rightly so.
Okay, thank you very much.
You're most welcome, Miss Wedderburn. Miss Blagrove, I'm seeing is that Mrs. Williams?
Yes,
Yes.
yes. I've been asked to find out about a particular drug, Hydroxyzalatan. The NHF only accept filling of the prescription for just every 25 or 28 days. But the drop lasts for just 14 days as it evaporates after a while. And when you go to the pharmacist, they said, no, it cannot be filled by the NHF, using the NHF card, because they only use it for either 25 or 28 days or 3 for 75 days.
And
I
this
remember I used to
is
hear this gentleman come on the radio and complains about the same thing, and nothing has been done.
the Zalatan eye drop.
Yes.
Mrs. Williams, in my experience as a past customer service representative of the National Health Fund, I've seen in scenarios where accommodations have been made on of course a case-by-case basis for patients who would have concerns or would make requests for an early refill of their medication. So I'm certain that once you are able to submit to us, maybe through the Ask Your Pharmacist program, or you're able to visit a card center location or emailing us through the info@nhf.org email address, then we are able to review the concern and we will be able to see how best we can accommodate maybe an early refill of the medication based on the limitations that stand.
Okay, thanks.
Are there any other questions? I'm not certain if I'm missing anyone with a hand raised. If you do have a question or have your hand raised, then you can go ahead and open your microphone and ask your question while we wrap up, and I hand over.
Hi, wait.
Okay, Ms. Farrow.
I had sent a text in the group chat asking you if you could display again the JADEP slide from your presentation or slides.
Certainly.
And explain a little bit more clearly as to how JADEP fits into everything and what additional benefits come from JADEP. I was a little unclear.
All right, most certainly. Let me just go back to that particular slide. Just so we are able to be clear. All right, so the JADEP program, which is the Jamaica Drug for the Elderly program, allows our beneficiaries who are registered with the NHF and are now 60 and over. For these 10 conditions that are listed on screen, they are able to access a select list of drugs free of cost at participating pharmacies. So that's the pharmacies outside of our drug serve pharmacies. Once they are JADEP participating pharmacies, then they are able to access those drugs free of cost at those pharmacy locations. And you're only asked to pay a pharmacy fee of $40 per drug item, and that goes up to $240 for 6 or more items.
So
yes.
My question then, the list of JADEP drugs is posted on the website, right?
That is correct.
And so while insulin may be covered, not every brand of insulin is covered. Is that so?
That's correct. So it's a select list of drugs.
Okay.
All those drugs are listed on the complete drug list that we have online. You're able to access and look for a particular drug. Once it is there, then you're able to access that drug free of cost at a JADEP participating pharmacy, only paying $40, a $40 pharmacy fee.
Thank you so much.
Good afternoon. May I ask a question?
Certainly.
Okay. Is there a list of JADEP pharmacies somewhere?
Yes, that is also available on our website, a full list of our participating pharmacy locations, including those that accept the NHF card, or you're able to access only NHF card benefits, and those where you're able to access your JADEP benefits as well.
Okay. All right. Great. Thank you.
You're most welcome. I'm not seeing a name for the user Samsung SM. I'm uncertain if they would like to also ask a question. I'm seeing that Ms. Ross and Ms. Brown also still have their hands raised. I'm not sure if they too still have questions. And then there's also Mrs. Roberts. Mrs. Roberts, you could go ahead with your question.
Good afternoon, everyone. Just a quick comment. And in fact, I made the notation in the chat that I think that it is precisely beyond these prescribed age limits, for pap smears, mammograms, and the PSA tests, that persons would most likely want to be able to benefit from the NHF, because that is when they have retired with, decreased earnings. So even for those reasons, it appears from what you said, if I understood you correctly, that cases can be looked at maybe one-on-one and so on. But I do think that it would be helpful. Those numbers are much likely to be less than those within the prescribed age group, because as you said, the incidence is expected to be lower. But, I think that should be taken into consideration. And I'm mindful of those of us who are CCRP members who are largely retired persons. Thank you.
That your concerns and the concerns of the rest of the members of the CCRP have been noted. I'm sure Ms. Patterson will help with keeping me accountable, with providing a response to the members as to how the way forward outside of those stipulated age limits and in regards to accessibility for those
I have them noted.
screening
I have them
tests.
noted, so you and I will speak after this.
Right, and I most definitely commit to providing an official response as it relates to that particular benefit. I'm seeing Miss Brown. Miss Brown.
Okay, just a quick, I don't know if it was answered. Is there an age limit for the mammogram? Because I'm not too concerned. I suppose I'm selfish. My doctor told me from our 70 that it was no need to continue doing the pap smear since I'd never ever in history had any negative. But that is me. So, the question goes on. But was there an age limit for mammograms too?
At this current moment, we do not provide a subsidy towards mammograms.
Okay.
The two screening tests, or the screening test that we do provide a subsidy towards, is the breast receptor studies, the HbA1c, the pap smear, and the PSA test.
Okay, thank you.
You are most welcome. Miss Holling, hopefully I am pronouncing that properly. Miss Holling, you can go ahead with your question.
Yes, I just want to know if the JADEP, if the NHF card can be used to get JADEP drugs.
And that's a great question. So it gives me the opportunity to reiterate that once you have an NHF card and you are 60 and older, you automatically qualify. So yes, you are able to use your NHF card to access your JADEP benefits. All you'd have to do is to visit a JADEP participating pharmacy, and once they have the drug available, you are able to access that benefit.
Okay, thank you.
I'm seeing Mr. Robert Carr and T. May. You are able to go ahead and ask your question.
This is Trudy. Trudy May is my name. T May is for short. I wanted to ask about what you just said about screening for the HbA1c. Is that under NHF or that's under JADEP?
That is under the NHF.
Under the NHF.
Right.
Okay.
So the NHF, sorry, go ahead. I'll allow you to complete your question before answering.
Okay, so it's just to present the NHF card at the lab when I'm doing that test?
That's correct. So
and all labs are supposed to?
No, not
No?
all labs. Allow me to provide that information along with the information about the age limit for PSA and pap smears, because I want to be certain that I'm able to direct the members to the correct labs where they're able to access that benefit. But no, not all labs would accept the NHF card for HbA1c. To add that the NHF card program is right. The NHF card program is under the NHF card program, rather, you would be able to access your NHF benefits and your JADE benefits. So it's not necessarily separate. Miss Singh, I will go ahead and unmute you shortly. Just wanted to complete that thought. So under the NHF card program, you are able to access both your NHF and your JADE benefits. So therefore, under the NHF card program, you are able to access the HbA1c subsidy. Miss Singh.
At some labs.
I'm sorry, go ahead, Trudy May.
Yes, I see you're saying you can access the HbA1c, but just at some labs.
At some labs, and I've committed to providing those specific or the specific location. It just slipped me, but I've committed to providing that specific location along with the official response with the PSA and pap smear. Miss Singh. All right, thank you, Trudy. Miss Singh, you can go ahead with your query. Miss Joyce Singh. Right, I'm not seeing where Miss Singh has a query. Are there any other queries before handing over back to Miss Patterson and team?
Yes, please. Good afternoon, all. How many months at a time can you fill your drugs with the NHF card?
I believe we allow up to 3 months medication for filling prescriptions.
Yes. 3 months?
Up to
Thank
3
you very
months.
much.
All right, you're most welcome. Is that Miss Matalon?
Yes, it is.
Okay.
Thank you.
Are there any other questions? Any final questions before
There
I
seem to be, there are some questions in the chat. One of them was asking chat.
All right. Wondering if somebody.
Hello.
Yes.
Can you hear me?
Is that Merlene?
Yes, it is.
Yes, Merlene, you can go ahead. But
Thank
before you do, I'm going to ask perhaps Miss Patterson to assist me with going through the chat to see what questions they might have. So after we take Merlene, we can just quickly answer the questions that are in the chat, and then we can hand over back to her for closing. Merlene, you can go ahead.
Good afternoon, everyone. Thank you for a very informative and interesting presentation. It was really delivered very well as well. Thank you. My question is about the NHF card. I think I've had mine for donkey years. What's the advantage to updating the card? Is it necessary I have both the NHF and the JADEP card?
Okay, so the NHF card is condition specific. That's for drugs. So therefore, let's say you were registered for diabetes, but over the years you have been diagnosed with hypertension. You would not be able to access the benefits for purchasing your hypertension drugs if you are just registered for diabetes. So therefore, you would want to update your card in instances where you might have been diagnosed with a new condition that the NHF covers. So that's the first instance. Also, you mentioned having both the NHF and the JADEP cards.
Correct.
We merged both cards. So therefore, from the NHF card that you have, you can now access your JADEP benefits. So if you'd like, you can take in your JADEP card to us and then continue to use your NHF card to access all your benefits.
So I take the JADEP card to you, and what do you do?
Well, because that is, we no longer use the JADEP card, then of course it would be disposed of.
Okay, okay.
Yes, we have merged both programs. So one card gives
Mhm.
you all your benefits.
Okay, so if I've added any any other problems, then I need to come in and let you guys know, is that it? To get
Right,
it on
that's
the card.
correct. You would need to complete an application form, have your doctor sign section C of the form to indicate the new condition to be added, add his signature and MCJ, and then you would submit that to us so that we are able to add the new condition to the card that you already have.
Is there any way of my knowing what conditions are presently on the card?
Most certainly, you are able to visit us at one of our locations and we will be able to provide you with that information.
Okay, thank you very much.
You're most welcome, Marlene.
All right. In the interest of time, maybe I could just help you with what's in the chat.
Yes.
This one is saying the following up on diagnostic test question, does one have to be registered for the specific condition before being able to benefit from NHF covered diagnostic?
That's a great question. So particularly for the PSA and pap smear, you do not need to be registered for a condition that is covered by the NHF. Once you, again, are within that age range, then you're able to complete only section A of the application form, take it to one of our locations, and you will be issued an NHF card to be able to access those benefits. However, for the HbA1c, you would have needed to be registered with one of the conditions that we would have, we now cover, or for the breast receptor studies test, you would have to be registered for breast cancer.
All right. Following up from that, the person says a condition may not be found out before an expensive diagnostic test may be required. How then does the patient benefit?
I'm not certain that I'm understanding that that question. Perhaps the person who had written it in the chat can provide a little more clarity. You said the
It says
question.
the reason for the question, the previous question about the diagnostic. A condition may not be found out before an expensive diagnostic may be required. I think the issue here is, does the NHF/JADEP really cover diagnostic tests?
Right. So the four that I would have mentioned, we currently cover, which is the HbA1c, breast cancer receptor studies, and the PSA and pap smear.
Okay, those are the only diagnostic tests
that we
currently
cover
covered.
to date, yes.
All right. I have to test my blood sugar 3 times a day. Can I get extra glucose strips for testing?
I would answer that similar to how I would have answered the question regarding the Xalaton, which is to submit the concern or the request, have it reviewed, and then an appropriate response will be provided depending on the case.
Don't we have it in?
All right. I think these ones, I think we've covered. We covered that. Can the card be accessed abroad?
No. This card would need, this is for Jamaican residents who would have applied and are able now to access the benefits locally.
This one says, sorry for what may seem a stupid question, but who is eligible for the NHF card, age and conditions?
Not a stupid question at all. The NHF card is available to all Jamaican residents once you have any of the 24 conditions that we cover, and also in the event that you are in need of a subsidy towards doing your PSA, which is for men, or your pap smear for women.
Okay. What happens when the pharmacist says that there's no money on the card?
That's a great question. And I just wanted to add to the last question. So there's no age limit, no age requirement to get an NHF card. So once you're covered, once you've been diagnosed with one of the conditions, you can get a card. A common concern that I get from doing a lot of presentation is that persons say that when they visit the pharmacy says that there's no money on the card. And just to note, the card does not store any money at all. Once it is swiped, the subsidy is reduced or is subtracted rather from the total cost of your drug. So there's no money on the NHF card. But what I find in those instances is that person would require an update of the card. So maybe that person would have maybe registered with the NHF some years ago for a specific condition, but they have gone to the pharmacy now to get medication for another condition for which they are not covered. So in those instances, we ask that you call us so that, or come in rather, so that we're able to guide you as to what you're covered for and what you would need to be updated or have updated on your NHF card under the recommendation of your doctor.
All right. And then the last question, regarding H1BA1C, did you say you can be registered for any condition on the NHF for it to be covered, or would you have to already be registered specifically for diabetes?
All right. So for diabetics who are registered with the NHF, they have an allowance of 4 HbA1c tests annually. So that's one test every 90 days. But if you are registered not for diabetes, then you are able to access the subsidy for 1 HbA1c test per year.
All right.
All right. So thank you so much, Ms. Patterson, and the members of the CCRP team. It was indeed a pleasure. I enjoyed answering all your questions. I've committed to providing you with official responses to the questions that would not have been answered today. And I'm so grateful that the information is being digested so that you're able to now go forward and either update your cards to maximize your benefits, or for those of us who have not already applied, you can go ahead and apply. So I turn back over now to Ms. Patterson.
All right. Sanasha, thank you so much. This is just so much more than we anticipated. And it's amazing when a presentation is well done, how much information can be conveyed in a relatively short period of time. We thank you. We appreciate this. So you and I will speak about those questions that we didn't quite get to cover, and then I will relay that to the membership. Thank you so much.
You are
And we
most
thank
welcome.
our members for turning out in your numbers to get this information. NHF, you're a model government agency, and we're very grateful to you. Thank you, Sashana.
All right, then. All right. Good afternoon, everyone. Enjoy the rest of the day. Bye-bye.
Yes.
133.
Sounds
So good.